Well, new technology is helping Texans start their own families. Our Dylan Scott shows us how it works.
As male fertility numbers continue to dwindle decade after decade, urologists across the country, including here in Texas, say now is the time to be talking about a relatively taboo topic.
A constant reminder of how lucky we actually are.
For Michael and Lindsay Bello, there are few joys like parenthood.
This is our Caroline Pearl Bello. She's 5 now, which is amazing. She's grown really fast.
This was our first family photo. This was her at the hospital.
Especially when doctors told them in 2015 having children was not realistic due to his reoccurring testicular torsion, a dangerous rotation that cuts off blood flow to the reproductive area.
Do your research, find the right doctor for you, and just don't quit because we have been told no. And that wasn't the case. Obviously, we have a blessing and a blessing on the way.
There are multiple reasons why we can see a sperm count of 0. And some of them can be as simple as a blockage or an obstruction.
Austin-based reproductive urologist Dr. Parviz Kavusi says 1 in 100 men, in this case Michael Bello, have sperm counts of 0.
When you do the math, 60% of the time in infertile couples, there's at least a contributing factor on the male side.
However, there are solutions to many of these issues. One of them, microdissection testicular sperm extraction, where, like in the Bellows case, Dr. Kavusi says about 70% of the time they have found viable sperm to be used for in vitro fertilization treatments, also known as IVF.
Every one of these patients feels like they're the only ones until we really talk about the statistics and how frequently we take care of this in our practice.
Still, between cost, which could be in the thousands, and the fact not every story will have a happy ending, he says researchers in the fertility field have room for improvement.
There are still a great deal of challenges with insurance coverage, and that's one thing that we're hoping for improvement with over time. We need better research, we need better techniques, and we need to continue to improve our technology.
You got a little something down here and over here, huh?
For the Bellows, sharing their story has been important, and helping others realize no two fertility journeys are ever the same.
A miracle in and of itself. She thinks in order for people to have a baby, they have to go to the doctor, which isn't really normal, but it's our normal.
Thanks for watching our YouTube channel. For more refreshing stories about your community, click the subscribe button over here. You can also download our Spectrum News app and tune in to Channel 55 on Dish and DirecTV to get live news coverage, weather updates every 10 minutes, and more. We'll see you then.